The Orthopaedic Hospital essentially is a single specialty hospital. So we deal essentially with musculoskeletal diseases and plastic surgery as two groups, two entities merged in one. It's for humanity. We have in our current register 736 patients. About 150 of these are awaiting surgery. They are awaiting surgery. Like I mentioned earlier in passing, Jute has been a very huge, big sister to us. And the CMD has been most brotherly in every aspect of the way. Orthopedic care is very expensive. It's unfortunate, but that's the truth. We don't manufacture anything here in Nigeria. All our prostheses are imported. All our implants are imported. Even gauze is imported. We don't produce any of them. So necessarily, prices will be expensive. But I want to assure you of one thing. It will be competitive, like other hospitals around here. NHA, unless revised, does not cover most of our exotic procedures, like hip and shoulder replacement. It doesn't cover it. It doesn't cover our fixations as at today. And the tariffs are abominably low to cover costs. But we have no choice but to fit into NHIA by federal government and Plateau State plus schema. We must necessarily fit into it. Actually, funding is a nationwide problem as it is today. Money has been released. We are processing it, but our contracts have not been paid yet. We're in the process of being paid. But like I've said, every parastatal MD right now are having financial difficulties. But monies have been released recently. You know, they're changing the policies of payments every day as it relates to the core exigencies of the times.
We are starting the full services, not just partial. We are opening the wards. We are starting operations in the theater. We are also opening our accident and emergency. The vision of this hospital is to deliver excellent and sustainable services in clinical musculoskeletal trauma care. And with this, we want to go with the mission that says to build generations of mobile people that walk freely without pain, healthy and functional population in this our ever-increasing musculoskeletal challenges. You know, these challenges are on the increase. And for us in National Orthopaedic Hospital, we want to do this by providing the following services. One of which we've started, as we have mentioned, the outpatient department. We are also going to offer services in trauma cases, most especially that has to do with the limbs, whether it's the hand, the upper limbs, or the lower limbs. The spine as well. We are going to offer those trauma services. And as a hospital, we have the capacity to reconstruct any parts of the joint, most especially those in the limbs. We have capacity to replace the hip, whether partial or total. We have capacity to replace the knee. We have capacity to replace shoulder and other joints that are replaceable.
All the orthopedic hospitals have affiliated teaching hospitals. And this one is official, is affiliated to Jos University Teaching Hospital. Because of that, when they started, you know, they needed support. Certain equipment, like the laboratory equipment, if you go, we had to give them, you know, because the procurement process it takes for them to get their own is ongoing, you know, but for them to commence, we said, why not? We have some of those things in excess. We can give them to start. When they get their own, of course, you know, government property, you have to document where it goes to. of course, we've documented and given them. Once it's done, we'll take it back when their own and the procurement process is completed. Then we can take it back. So I think it's any area of collaboration, anything they need, he knows. In fact, before now, they started their office started. The temporary office started at the Jos University Hospital permanent site. We gave them an office furniture for administrative before they finished the renovation of this place. So I think I cannot finish, but we have a very good rapport, very good relationship, and whatever we do to support them, we will continue to do that until at least they start flying with wings. But this is commendable. Thank you.
With 13 bed spaces.
We're going to the next one now.
We are going to the next ward from here.
We're starting with this. We'll take more spaces, more accommodation as we expand. Our resources are available to us.